How do risk factors affect breast cancer mammogram guidelines? How do risk factors influence the guidelines for breast cancer mammograms? Understanding this can help women make informed decisions about their health. Risk factors play a crucial role in determining when and how often women should get screened for breast cancer. These guidelines vary based on whether a woman is at average risk or has a higher risk due to personal or family history, genetic factors, or previous radiation treatments. For women considered at average risk, meaning they have no personal history of breast cancer, no strong family history, no known genetic mutations like BRCA1 or BRCA2, and no prior chest radiation before the age of 30. Mammogram screening usually begins at age 40. Major medical organizations recommend starting screening mammograms at this age. Depending on individual circumstances and discussions with healthcare providers, women may choose to have annual or biennial screenings. For instance, the American Cancer Society suggests that women aged 40 to 44 can opt for annual mammograms. Women aged 45 to 54 should have yearly mammograms, while those 55 and older may switch to every other year or continue yearly screenings based on personal preference and health status. The U.S. Preventive Services Task Force recommends biennial screening for average-risk women aged 40 to 74. On the other hand, women with higher breast cancer risk, such as those with a personal history of breast cancer, a strong family history, known genetic mutations, or prior chest radiation therapy before age 30, are often advised to start screening earlier and undergo more frequent mammograms. This may include beginning screenings before age 40 and possibly using additional imaging methods like breast magnetic resonance imaging to enhance early detection. These recommendations are tailored to each individual and should involve discussions with healthcare providers to weigh the benefits against potential risks of more intensive screening. In summary, risk factors significantly shape mammogram guidelines by prompting earlier initiation and increased frequency of screenings for those at higher risk. In contrast, average-risk individuals typically follow standard age-based screening starting around age 40. These personalized approaches aim to optimize early detection of breast cancer while minimizing unnecessary tests and false positives, reflecting the current scientific consensus and expert recommendations. Always consult with healthcare professionals to determine the best screening plan for your unique situation.